The Bonn Vein Study is one of the largest and most quoted medical studies looking at how common venous disease is. It looked at over 3,000 adults. The participants completed a questionnaire. They were examined carefully and they underwent an ultrasound scan. They were allocated into one of 7 classes. C0 being a completely normal assessment with no signs of vein abnormality, all the way to C6, which is an open leg ulcer. There are 3 striking findings from this study. Firstly, fewer than 10% of the participants had completely normal legs. That is, no spider veins, no varicose veins, and a completely normal venous duplex ultrasound scan. Secondly, nearly 1 in 5 people had either swelling, varicose eczema, or ulceration, that being a significant complication of their veins. Thirdly, over a third of those in this study had superficial venous reflux on ultrasound. So as you can see, venous disease is very common. Another important study, the Bonn Vein Study, looked at over 1,500 adults. It too involved a questionnaire, a standardized assessment and classification of venous disease in the legs, as well as a standardized ultrasound scan to detect venous reflux in the leg veins. A follow-up 13 years later included a reclassification to see if there had been any deterioration or progression of the varicose veins or if complications had developed. Nearly half of the participants with venous disease deteriorated over the 13-year period, and almost 1/3 with varicose veins developed a complication. These 2 studies, the Bonn Vein Study and the Edinburgh Vein Study, confirm that vein conditions are common and that they get worse with time. The latest findings from the Bonn Vein Study strongly suggest that early treatment of varicose veins prevents deterioration and helps avoid complications such as varicose eczema and leg ulcers. It has been estimated that the National Health Service spends £5 billion annually on treating chronic wounds, of which £1 billion annually is spent treating venous leg ulcers. Leg ulcers and other vein complications such as phlebitis, varicose eczema and thrombosis cause distress, pain, time off work and a considerable economic burden to the NHS. So vein problems are indeed common and very important.